We're going to go into those protocols in a minute, but what did we do alongside of what we could do? We looked at, as Dr. Dow mentioned, we started working together, looking at how traditional Chinese medicine could help ovarian physiology, follicle physiology, ovarian balance, all of those things. And the literature data supporting this based on prospective clinical trials is difficult. I'm going to show you one study. It's a good study, but there's just not a lot out there. So you have to understand, he taught me what ultrasound and herbal medicine can do. A lot of doctors say, oh, it's going to interfere. I don't want you taking your herbs. I don't want you doing that. How do they know? What do they know that, why is that bad? I've always asked them, what is it that's bad? Well, it just can interfere. Hormonal supplementation, supplements, natural supplements, we'll talk about these in a moment, but these are not bad things. These are helpful things when they're done by people who are knowledgeable in Chinese traditional medicine, herbal acupuncture medicine. These are supportive and helpful. This is a study that's quoted a lot, and this was by saying in 2015, they did a prospective randomized clinical trial using transcutaneous electroacupuncture stimulation versus a mock treatment cycle. And they had a good group of patients, and they were able to show that there was a significant improvement in clinical pregnancy rates per cycle compared to non-treatment or mock cycles in a poor ovarian response category. So when somebody says it hadn't been proven, this is it, 2015. DHEA. DHEA is talked about, you hear about it, all your patients ask about it. Norbert Gleischer is primarily responsible for all the kind of the literature with DHEA and poor responders. The theory behind DHEA is as follicle recruitment is taking place over that 60 to 90 day period of time before it becomes activated and visible on day 2, those follicles on day 2. Androgens are important for follicular activation, primordial follicle activation, and that period of time between that and when they reach active state on day 2 of the cycle. And he did some good studies. Unfortunately, most of them were retrospective. Not a lot of prospective, but it has been shown that DHEA will help activation, increasing the number of preantrals along with the FSH activity that gives you better follicle numbers. It is necessary for that 60 to 90 day period of time. Whatever you do, when a patient comes from one of you guys and working with you and she says, I'm ready to start, and I say, well, what does your herbal acupuncture person tell you? When are they ready for you to start stimulation? Because I tell them it's going to take a minimum of 60 days for you guys to get them in a balance, just like if I'm putting them on DHEAS or CoQ10 or anything else, it takes that much time for that effect to show too. So we all have to be on the same page. They're anxious to go. They want to go today. They don't want to wait the 30 to 60 days or 90 days. But I tell them that's the most important thing to do. So all of these things take time. I've been around for a while, and I've just kind of put my little things together on avoid suppression, no Lupron, no birth control pills. Don't use high-dose stimulation drugs. Don't begin your stimulation until everything's perfect. These patients have been through multiple stimulation and failure. And that's why they're depressed. That's why they just walk in hammered. So you've got to make sure that when you give them drugs, they've got what those parameters in your book, my book, they have to all be in line. Otherwise, we're just going to frustrate them more. Look at past stimulations. That tells you a lot about what their ovarian follicle physiology is going to be. Be sure that you're counting real follicles, not ghost follicles. Synchronization, synchronization, synchronization. I can't say it enough. And then you have to listen to what you've learned in the past. What did you learn about basic two-cell theory, follicle response? Everything that you've learned in your career needs to go into these poor responder patients. They are difficult. They are trying. They can frustrate you just like they're frustrated themselves. So you have to approach them with a lot of patience and deal with the ups and downs. Thank you.